Good afternoon. Today is February 19th, 2021. My name is Scott McGann, doing our weekly COVID update for the town of Falmouth. For COVID enforcement, COVID questions, 508-495-7485, which is the health department's phone number. health@falmouthma.gov is our email. falmouthma.gov is the town's website. There's a COVID link that gives you links to everything I think you need, COVID vaccine, COVID question related. And the county also has a call center at 774-330-3001. So I'm going to start out talking about the vaccine. It's been really a difficult time with the vaccine, getting appointments due to the shortage and the lack of quantity, especially here on the Cape. Even with the difficulty of getting the 75s done, the 75 and older grouping done here on the Cape, because the state is really focusing in on mass vaccination sites and also pharmacies, it's been really difficult. There's also the online registration issue that 75s have happened. But in the ultimate wisdom of the governor, he opened it up to 65 and older and any individuals with two or more comorbidities this week. That doesn't mean there was a lot of extra vaccine. So it's just made sort of trying to get appointments and get things a little bit more difficult. Actually, the website, I believe yesterday, crashed in the morning of anybody who was trying to get on there. It's really a factor of there's not a lot of vaccine. The state's only getting between 100. I think they're going to go up to 130-something thousand maybe next week is what they're getting. So it's getting really difficult to get an appointment. It is. You are open if you're over 65 or anybody with two or more comorbidities. That's the phase that we started. That started on the 18th, started yesterday. And if you tried to register, it was really a real trying experience for everybody, and most people probably were disappointed. And we'll talk about that in a second. Right now, you have to register on the state's website. I'll show you what it looks like. So vaccines in very short supply, and it's going to remain. Barnstable County is getting around 1,000 doses. A case of Pfizer happens to be 975 doses, and that's about what we're getting in a week to the county health. We did a clinic on 2-3. It's been rotating between the different sites, just because to make it fair and have it, down Cape, mid Cape, in the fairgrounds, rotated around. But we obviously haven't been doing much at the fairgrounds just because, you haven't gotten to our point where we come back around to us, and there's just not a lot of doses. Beginning 3/1, the state's even moving away from smaller clinics and focusing on mass vaccination sites and pharmacies. We got a letter from that this week. We will still have our clinics and vaccine, as vaccine becomes available, at Barnstable County, because we've partnered with them, because they don't want local boards of health doing the vaccinations on a large scale. We are ready to rock and roll with doing thousands a week if we receive the vaccine. Now, as far as registration, we'll talk about that in a sec. If you cannot register online, there's a 211 number. Right now, we also have the ability to do one at the town level. The problem is right now to register yourself for a vaccination. Let's take yesterday, for example. Some people I've heard that took 6 hours of refreshing and they got an appointment. Some people said they did 8 hours and didn't get an appointment. So having that number for you to call to register doesn't work well when there's nothing to really register for, when everybody's fighting over the few doses that are available. But as vaccine become more and more available, then we would be able to open up to help people that can't register themselves. But right now, there's just so few vaccines that they're going really quick, especially now that we opened it up. And you opened up to another 1 million people when you, in my opinion, didn't have enough vaccine to do the 75s and older. But just to let you know that Barnstable County and Falmouth, we're working with Barnstable County on the big clinics, are definitely ready. We just need the product. We just need the vaccine. I know the state's been focusing on areas that have had higher infection, so you see a lot more vaccine going into the Boston area, North Shore. But at some point when it starts to come to us, we are ready to start vaccinating at a much higher rate than we currently are. It's not for a lack of trying. It's not for anything particular other than the state is determining where the vaccines are going. So when you go on the website, this is what it's going to look like. Okay, this is like the front page right there. And then you would scroll down and you would see this place that says Find Your Appointment. And when you click on that, it'll be the bottom half of the screen, and you would search by zip code. And you would eventually get, and also on this website, if you went back up here, you can get down to this place where it shows you the different stars. That's another way of doing it. And so you can register through this site. Now, when there's a lot of vaccines and you're good on the computer, it's pretty seamless. But if you're having trouble with the computer, it makes it a lot more difficult. And when there's no appointments, then you're just getting locked out because somebody got there before you did. And so the system, in theory, I guess, is workable for most people, but the problem is, again, lack of vaccines and lack of appointments. You don't set up a clinic, so you don't see Barnstable County Fairgrounds show on here unless we have vaccine in hand to do a clinic there. So you're not going to be like, I'm going to click on it and it's just we either say no appointments available or not even be on there, just because there's no vaccine to put into it. So talking a little bit about it, the blue stars are the private sector, the Falmouth CVS, East Falmouth CVS, or maybe the grocery stores and pharmacies, and any of the different ones will be in blue. The large ones, the state sites, is Dartmouth, Foxborough will be the two closest, Gillette Stadium. More stars are coming in during the week as more of the private sector rollout continues. So as pharmacies start opening up more spots. That's where the state wants to throw most of the vaccine, is towards the mass vaccination in the pharmacies. At Barnstable here, we're ready, since we don't have a mass vaccination site all that close, especially if you live further down Cape, that we need, if the state gives us vaccine, we basically would become like a mass vaccination site and would do it. We're ready to do it, like I said previously. Our sites right now are the Melody Tent, the Fairgrounds, the Orleans DPW, and there's a couple of down Cape ones. I just can't remember where they are. They're on the seashore parking lots. And so we're ready to begin vaccinating. Eventually as more vaccine comes in, then I could do some more Falmouth-focused clinics. I'm ready to do things at the high school. If there's enough vaccine for the clinics at the regional level, then we'd love to have been able to. But this week, the state has been saying that we're shying away from local boards of health. So my ability to do that is going to be based on whether the state changes that as well. There's also a VNA component. The homebound qualified senior housing, low-income senior housing. If they qualify, can work with us. If they want to partner with us, there's also private entities that they could also partner with. If any of these entities want to partner with us, then we would place an order separate from the county for that, and if we do get the vaccines, would be able to do that. So it was also working on, so VNA would essentially be more of a fine-tuning type of device, so entity that would be doing sort of the smaller stuff. All that in theory works great, but you actually need the vaccine to do it, and that's what we're waiting for. So keep checking. I guess the best thing to tell you is to keep checking on these appointments as more of them get in there, and also have to be flexible about where you go. If you can't get to Gillette, then you're going to have to sit patient until more vaccines become available locally. When you click on it, it takes you to a link, and then you can click on the particular link and it takes you to the website. And then this particular one is PrepMod. This is what the counties look like. You would click on Falmouth, the vaccination, senior adults, and this would come up when there's vaccine available. The problem is that because there's so few vaccines available, these sites are taking 20 minutes to fill up 600 appointments or 800 appointments or whatever it happens to be the number. So it's going really quick. Gillette can show up as well. That tends to have a lot more vaccines because that's where the governor is putting the vaccine. You can also, when you click on some of the pharmacies, you're going to come to a different website and you'll be registering directly with them. So CVS Pharmacies looks like this if you click on it. Walgreens looks like this, and you go through the process. It's real cumbersome, especially if you're trying to fight it because you have to keep jumping back and forth. It's really frustrating, and unfortunately there's nothing at the local level we can do about that. So that's about registration, so you have to just keep hanging in there and trying to do the best you can with it. As more vaccines become available, there's more appointments. We have the ability to help register you if you don't use a computer. It's just at this point with so few vaccines, we're not going to be able to jump the line that way and be able to register for you if they're all going in 15, 20, 30 minutes. Can't stay on there for 6 hours waiting, keep hitting the refresh button to get one person registered. And so that hopefully, again, this is probably the second, going into the third week of this. I hope that things change quickly. In terms of, this is from the state's website, in terms of cumulative COVID vaccine doses shipped, Barnstable's at 27,675, which is 2,800 more than last week. You can see that the counties that have had highest infections, such as Suffolk, Middlesex, and Essex, also more people live there, has seen the majority of the doses, Worcester County as well. So we've been on the low end for that in terms of the number of doses, in my opinion. But we did do 2,800 this week. Some were the Barnstable County clinics. Some would be from people going to Gillette. Others might be some more long-term, phase 1 type of vaccinations that might have been done as well. In terms of by county, we're up 1.3% from last week, but 12.8%, all right, of doses shipped based on population as a percent of county population. You can see that, other counties have received more, some counties have received less. It just happens to be the way the state's divvying up the vaccine. So it's minimal for 1 week, but it is what it is. If you look at this is the cumulative percentage of residents with vaccine doses administered by county. So residents with first doses, according to and again, this doesn't take into account our snowbird population who didn't go south for the winter, that stayed here during the pandemic. This is going to be residents, and a lot of those may not count, but it's 15.1% has been administered their first dose. That's going to include so we have a lot of long-term care. We have a lot of health care. Cape Cod Health Care is the biggest employer in the Cape. So they were done as part of phase 1. But once you get into phase 2, I don't think our Barnstable County is going to be faring quite as well, but they don't break it down that way. It's broken down since the beginning, since the vaccines were administered for phase 1. About 4.4% have had the second dose. So that's the state's numbers there. So that's it about vaccine. It will get better. It'll get to a point where we can do the clinics a lot more frequently at the fairgrounds or wherever we happen to be able to do the clinics according to the state. It might be some, one big giant clinic because that's what the state prefers. I would prefer it to rotate it between the 4 sites we have now to give people less of a drive. You think it's bad for Falmouth? It's, if you live in Truro and you have to come all the way down to, let's say a central location in Barnstable, then, that's a long trip as well for some. But that being said, that as soon as we get more vaccine, we are ready. So it's not the towns, it's not the county, it's not anybody sort of just dragging their feet. It's just, we just need more vaccine. So in terms of cases, so that was not good news, and I wish it was better. But as far as cases, we've had a good couple of weeks, considering where we were in the beginning of the year in January. So it's 1,142 cases. 33 probable since the beginning of the month. There was 23 confirmed cases last week. We were 25 the week before, so 2 weeks in the 20s is way better than the 190 we were having before. Well over 90% of the cases are no longer in isolation. We account for about 11.8% of all cases in Barnstable County, with 14 being expected based on our population. The VNA and, of course, the CTC at the state level and ourselves continue to do the contact tracing. Nothing has changed on that. So if you look at our weekly case trend, you can see that we've had 2 good weeks after having a really high peak at the end of January of being well up over 110, which was our highest week ever. We've gotten back down. Now, that being said, this is school vacation week. There has been a lot of travel this week. I hope people heed the guidance and they quarantine and they get themselves tested and follow the state guidance, because what we don't want to do is start to bring cases back to Falmouth and then we have to have another spike to bring back down again. But it was school vacation week, so hopefully we can continue to keep it low, but only time's going to tell. Because you can clearly see that the Thanksgiving and Christmas was the main driver of these cases earlier on. The previous month would be easily attributable primarily to the holidays. So we've had 2 good weeks. We'll take it, no doubt. You can see a slight flattening in this curve. This curve tells you this is just total number of cumulative cases. And we had it really flat in the summer, and then we had a decent early fall, and then basically from Thanksgiving we've had the bulk of our cases happen from Thanksgiving to the end of January, the vast majority of our cases. So, hopefully we can flatten that back down, and things like vacations and so forth doesn't cause it to start to go haywire once again. Again, red or yellow, we have this metric that comes out every week, and it's based on a positivity rate and number of cases. This week we remain yellow again, but had a really good week. We've gone in the last 3 weeks from 4% positivity. That's just the total number of positive tests, based on the number of total tests. We went down to 3.16, and then we went way down to 1.90 for this time frame. This is data current from 2/16, and this is 2 weeks prior. So we're doing a lot better than we have since the holidays, and again, want that to continue. If we can get even lower, we could conceivably go green. We're low enough in positivity But we need to get, obviously, even have to get the cases down further. But we're not even that, if we can keep dropping, we'll be in the green, which would be awesome. But we're not in the red, and we're heading in the right direction, and that's good. The state's also in a better spot, as is the county, and we're doing better than both. And we typically do, and so hopefully we can continue that. Barnstable County shows you a decrease in this. The numbers don't matter as much, but you can see that it's been trending downward everywhere. Statewide, it's also in the downward trend. If you check this every day, this comes out about 5 o'clock. Been hovering around the 18 to 2,200 cases a day, which is way better than the 6,000 or 7,000 we were getting. The deaths are still on the high side, but there is a delay to that. So cases that might have happened in January, people are on the vent, people it doesn't happen immediately, so there's usually a delay. Hospitalizations are around 1,000, and with 270 to 200 to 300 people in the ICU, 173 in the state intubated. Those are all on the downward. Percent positivity for that same 7-day for the 7-day period that they're calculating was a little over 2. Get under 2, that's really good. Test-wise, it's taking about 1.75 days. It's usually somewhere between that and 2.5 days for a test result to come back. But all that shows that we're in a positive trend. You can see it here by seeing the downward trends on all the different metrics, the cases, the testing, positivity, the hospitalization, and the deaths all show a downward trend, and hopefully that continues. You stop vaccinating more and more people, the positivity is low, you're in good shape, and that's what we're hoping for. Cape Cod Hospital and Falmouth Hospital, 217 is the last time I've got this data. Falmouth had 9 in the hospital, 1 in the ICU. That number's been fluctuating under 10, but usually more than 5, between 5 and 10 for the last few weeks. And you can see that from 2.2, 2.9, and 2.15, you see in that sort of 6.1. Cape Cod Hospital, there's more people from that area, but they've been averaging in the teens, and that's kind of where they are now. COVID testing hasn't changed. You still can do the community center, the East Falmouth CVS, the Convenient MD, Community Health Center for Cape Cod. There's also Cape Cod Hospital. Barnstable County, you can register actually at the fairgrounds by calling the fairgrounds to register for a free test at the Barnstable County Fairgrounds site, which is the same place we do the vaccinations, but on days that we're not doing vaccinations, then we did testing. So you can call, I should put that in there, I meant to put that in there, but you can call the fairgrounds and they'll actually schedule that with you. That's no charge for that. But that's not open every day, because again, you have to staff it with volunteers. It's not it's not like a place that's open all the time like a CVS would be or a Convenient MD, but you can call and inquire about that through the fairgrounds. And thanks, Wendy, for doing that at the fairgrounds. Again, continued diligence. The travel thing, the school vacation, actually it's this week. I didn't change that slide. The travel thing is something that we have to have control over. That's how new cases come in. Again, stay at home when ill, self-isolated, get tested. Most people know that and are well versed in it by now. Social distancing, face coverings, good face coverings, hand washing, hand sanitizing, the gatherings, the parties, the indoor social, non-social distance things are all the things that cause cases to occur. And again, state sector's guidance hasn't changed in a few weeks, but if you do have questions, if you're a business owner or daycare center or gym or whatever, then we do get a lot of those calls, and we'll work through the guidance as needed. So again, as far as getting vaccinated, if you have questions about that, you can get on the, this is from the state's website, trust the facts, get the vax. Not everybody will get the vaccine, but we'd like you to get it. It's going to get us out of the mask wearing, social distancing things. More people we can vaccinate, the quicker. Obviously, we need the vaccine to do it. So, yeah, you can find that on mass.gov as well. So as a recap, state metrics are definitely down. Falmouth, we've had, back in the yellow, I think 3 straight weeks with 2 weeks of 25 cases or less. School vacation week, hopefully people did heed the warnings and are doing things right and following the travel guidance and getting tested upon arrival. A lot less community spread, having a really good couple of weeks, much better than January. Regionally, vaccines being administered as it arrives. When the supply gets better, we'll have way more clinics. And then we'll be able to help register people because there'll be more opportunity. We can get stuff done as opposed to hitting refresh buttons for 12, 13 hours, which is ridiculous, but that's the way it is. So the state did send us a letter. The vast majority of vaccines is being sent to the state sites at this time. The state's indicated that as of 3/1 that pharmacies and mass device will be where you'll have to go to get your vaccine. There'll be less local clinics, and we're working to make sure that since there's no mass, state-run mass vac site, we need to have one on the Cape, and the county and in all the different towns, the county and health agents are talking multiple times per week on Zoom to make sure that we're getting we all know what's going on and we're all ready to go. We could be vaccinate thousands of people per week if we had the vaccine. It's not that we're not you just don't have the product, and there's not much we can do about it. And when it does come in, we will be jumping on it and having it. If you happen to be listening to me and you're homebound and you totally cannot get anywhere, you could call the senior center to talk to them, and we are trying to get a list of those that are homebound, completely homebound, not somebody who wants it conveniently. We're talking truly homebound. If you're truly homebound and you want to, we're looking for those because we will be able to take care of that as time progresses and the vaccine comes in as well. So I just wanted to let people know that as well. So that's the update for the week. I'm sorry it went kind of long today, but there's a lot to talk about. And we'll see you again next week.